Hi, this is Jacqueline Eckern with Eating Disorder Hope, and I am delighted today to be interviewing two very knowledgeable nurses about eating disorder care and hope. And with that, I'd first like to introduce Lisa Salo with Princeton. Can you tell us a little bit about yourself, Lisa?
Sure. I have been with Princeton for many years. I have been a nurse on the eating disorder unit for almost 3 years. I am a bachelor's of science in nursing, and I also have my psychiatric mental health nurse certification as well.
Wonderful. And Anna, can you also tell us about your experience and background?
Sure. I've been with Penn Medicine, Princeton Health since about 2016. And then I've been with the eating disorder unit for about 3 years now. And same with Lisa and a number of our nurses. We have our psych and mental health nursing certification.
Excellent, thank you. So we are today diving into an excellent article that Lisa and Anna have written. And I would like to start with asking you guys to tell us about what Princeton's come up with in studying hope and how nurses can further hope in eating disorder strugglers and people dealing with eating disorders.
You want to start, Lisa?
Sure. So what we found, I guess the project that Anna and I spearheaded, we had been working on it for at least over a year. It is a very eating disorder population, and of course that never comes by itself, right? There's a lot of other mental health disparities and disorders and chronic illnesses that these folks have, and we felt we really wanted to work on something related to hope. And I think we had both felt that individually. And I think also our manager, Lauren Furman, also kind of had her own thing. And then our director of our program, Robbie Alexander, she had done a study several years back and looked at nurses engendering hope. The perception that the patients had as to whether or not nurses engendered hope in the eating disorder population. And there really wasn't a lot of research out there. So we decided that we would, once we all realized we kind of wanted the same thing, and it kind of, the project had like kind of started and stopped in like a few different times. But once it really got rolling, we encouraged the day shift nurses to participate with us. We searched for research articles about hope, and we looked at what helps hope and what discourages hope. And that was kind of an eye-opener, because we looked at articles that did not just pertain to eating disorders, but also cancer patients, patients with chronic lifelong illnesses, patients with addictions. So it was that was sort of the beginning, and we looked at research articles.
That makes sense, to definitely go out and look at what's been studied. And then what I appreciate is that you wrote this article titled The Importance of Nurse-Engendered Interventions to Promote Hope in Patients with Eating Disorders. So all of us get to benefit from your research by just reading the article and all the studies you reviewed. Anna, what would you like to say about this project?
For us, I think as our unit has developed groups, I mean, we take just as much of a part in the treatment for our patients as, you know, even the therapists and the dietitians. With reading, you know, Robbie's article and then doing our own research, it was kind of disheartening that there isn't that much out there. And I think I don't know, Lisa, if you can agree with both of us, it really kind of set that fire to find out more and to find out how we can help, you know, these patients the best way we can, because we're with them 24/7. So, seeing a lot of our patients and kind of where the stages they're at in their illness, I think for both of us, like, we're really passionate about it. So it was like kind of a great opportunity feeding from Robbie's article.
Mm.
And it started off as, wanting to do kind of our own research. But then it became, an opportunity for, a whole curriculum.
Mm-hmm. I
Good for
agree.
you, and good for Princeton for putting in the effort to explore hope and define it better for us, and to create a curriculum. So in reading your article, I was wondering if you could highlight some of the things about why sometimes individuals feel like they don't deserve to recover.
Well, I know that with eating disorders, there is a very much so a high level of depression and anxiety that goes along with that. So I think that contributes to some of it. They also, a lot of patients come from, maybe they've had, past trauma, family issues, all kinds of personal issues, and they just feel not deserving of recovery at times. Did you want to add to that, Anna?
Yeah. And I think with, with some of the population that we see on our unit, they've been suffering for years. So I think as they're, as it's progressed, I think they've gotten to a point where it's like, I've never been able to recover. I've been a burden on my family, my friends. Like, what do I have to offer? Why do I deserve it? I think we see that more with patients who've been, like we've said, like the severe and enduring for so long.
Mm-hmm. Yeah.
Yes, that completely makes sense. So in your research, what does provide hope for eating disorder recovery to these people that in many cases have struggled for years and are also dealing with co-occurring depression, anxiety, and probably some underlying trauma?
I think that, would you repeat it one more time for me, please?
Yeah. What provides hope for eating disorder recovery in these individuals?
I think so. We designed the curriculum. You know, like I think we have said before. We can't bring people to hope, right? They have on it. There is some accountability on the patient's part, but I also think that what provides hope, I think, is us going in and taking the time to have the group, number one, to show them that they're important, but I think also that they are able to learn how to create goals in this group, because our kind of thought process is, and we had read a lot of Charles Snyder's work, our process is basically, if you are setting goals and working towards goals, then that gives you something to look forward to or to hope to. And then hopefully those stepping stones will be created and people can then, with their own forward momentum, continue to set goals and know that they can achieve things and that they are worthwhile and that things are possible. I think with the eating disorder and the mental illness, a lot of times people are more apt to give up really quickly. So I think that this gives them the support that, just because you hit a roadblock doesn't mean you have to stop.
That is interesting to me because I have been in eating disorder recovery for many years. And I can remember always having this stick-em note on my desk that said, "No way out but through." And it was just an encouragement to myself to always get back up on that horse. Man, just because you fell off the horse, the show's not over. Just get back up on that horse.
Right.
Anna, can you say anything further about what your thoughts are that provide hope for eating disorder recovery?
A lot of based off of what Lisa just said. I mean, we're kind of giving them guidelines. But in reality, we're helping them build it on their own. We're giving them the keys to developing these goals, identifying what stands in their way, what to do if they hit something that, an obstacle in their life. Because like Lisa said, many of them for relapse, it's something blocked their way. So a lot of this is being able for them to identify, this is a goal I want. How am I going to get there? What to do if, something happens? But in reality, it's really them discovering it on their own. We're just kind of giving them guidance.
That's wonderful, because you're supporting that internal locus of control and their own competency to manage their lives. So that I see the value of that. What have you found that particularly discourages hope in those seeking eating disorder recovery?
I think not giving them time, like your time of yourself. I mean, as a nurse, I think the one thing that we most often learn in nursing is your giving of yourself. And it's true in all different areas of nursing, but it is never more true than when it's in mental health. And I think your time, we had just spoken with someone else earlier about the same article, or not, this article, but a different one. And we had said, like the patients genuinely seemed touched that when we introduced the group, that nursing had taken the time to actually like research this and put this together, and that it had taken us over a year. Like they genuinely seemed like, you did that for us, which was kind of cool.
Yeah. And kind of as far as something that we've seen along the way, that's kind of getting them past that barrier is something Lisa, I think, mentioned earlier today, was the black and white thinking. It's all or nothing.
Yeah.
And getting past that it's not all or nothing. Like there are gray areas in life, and it's okay. You're going to have things come up that are going to be difficult. But like you said, get back on that horse and keep pushing through. And it's just getting like, the patients to realize for themselves what really is it that they want. Like what is the possibilities in the rest of their lives. Because we see patients of all different ages, and we're kind of getting a sense from other groups that we do, kind of the mindset between, the 18 to 20-year-olds, and then on up to like, we've had, 60-year-old patients. So it's that wide range of kind of where their mindset is at this point.
So this goal setting and maybe even a vision of what you would like your life to be, hopefully congruent with your values, is what you're helping folks to develop in this group. Is that accurate?
Yes, I think that, whether or not a person, maybe they come from a family that's not as supportive, or we get a lot of patients that the family doesn't really have the insight into the eating disorder. And so kind of helping them to set goals, and to learn, maybe I can do this, there's so much codependency and all those kinds of things that go in with, that go hand in hand with the eating disorder. And sometimes families don't get it. And sometimes you have to teach these adults that's okay. If they don't get it, you might not ever be able to get them to understand it. However, these are goals and things that you can set for yourself, because your life is possible. It's possible to still have a good life, even if the people that you love maybe don't understand what you're going through.
Makes sense. So you've referenced Snyder's hope building curriculum. Is there anything that you would suggest people read up on, or anything further you'd like to say about the theories that Snyder brings to the table?
Yeah, the one chapter, he wrote an entire book about hope, but a lot of the one chapter that we used a lot was called Kindling Hope in Adults. And that was where we had gotten a lot of our um, ideas and, you know, and things to create the group.
Mhm.
That makes a lot of sense. So this article, for those watching, can be, you can just do a search for the title, which again is The Importance of Nurse-Engendered Interventions to Promote Hope in Patients with Eating Disorders. And if you're seeing this video on social media, just click on the link below and it will take you to the article. Lastly, could you just tell us a little bit about Princeton and why people watching this might want to check out your program to see if it's a good fit for them?
Uh, you, go ahead, you
Yeah.
go.
So with Princeton's unit, the thing that kind of sets us apart from, you know, some of the other programs out there is we do offer the inpatient side of it. So you have the medical aspect, but we also involve nursing in running groups and educating. We do group therapy along with individual therapy. So I think that kind of sets us apart from some of the other programs. And then as well as, you know, the on staff, the dietitians as well. They run groups, they meet individually. So it's a very kind of well-rounded, multidisciplinary program.
Sounds like very intensive, personalized care in both a group and individual setting, which is wonderful. That's what I would want.
I would add that we have excellent nurses that have extensive medical experience, because I know both Anna and I came from medical to work on the eating disorder unit, as well as a lot of other nurses that had done medical. And also, I really do say this, like, that this, I mean, I stay at Princeton because I really do love the nurses that I work with. And I really do believe that we have nurses that are really, really compassionate, as well as the other staff members, you know, the dietitians and the therapists, as well as the docs. I just feel like, you know, nursing, we're there 24/7. And I feel that it is our caring presence that really makes an impact on the unit.
I wholeheartedly agree. So if you're watching this video, you can contact Princeton Center for Eating Disorders for more information at 855-636-7217. You can also just go to the Eating Disorder Hope website and do a search of Princeton and it will come up. You can also go to Eating Disorder Hope and do a search for the article and it will come up. Thank you for your time, ladies. We really appreciate it. And thank you for the life-saving work that Princeton's doing to help those struggling with eating disorders.
Thank you.
Thank you. Thank you for everything you do.